Hello, I am Dr. Shekhar Srivastav. I am Senior Orthopedic Consultant at Sant Permanent Hospital, Delhi. Osteoporosis is a condition where there is weakness of bone because of increased bone loss. Now, as we grow old, there is increased bone loss from our body. So the bones become more fragile, they become more prone for fractures. Osteoporosis though affects both men and women, but mostly it is seen more commonly in females. In fact, if you see the statistics, it affects almost 1 in every 2 women and 1 in every 4 males in population which is more than 50 years. This is the appearance of a normal bone, where you can see that there are holes or lacuna in between the bone. Now in osteoporosis, what happens, these holes or lacuna, they become more large, and the amount of bone between these lacuna, they become less. So the bone becomes less dense and they become more prone for fracture because they become fragile. So you can say that it is one of the silent epidemics which affects the population of the whole world. The symptoms of osteoporosis are not evident till the patient suffers a fracture. Till then, it's a silent problem. Progressively, the bones are getting weak. The patient may complain of some backache or some other generalized bone pain, but he is not aware that he is suffering from osteoporosis. Now, as the bone becomes gradually weak, then even minor trauma, which normally would not cause fracture in a healthy individual, they causes fracture in osteoporotic bones. So these fractures are also known as fragility fractures. And the common bones which are fractured in osteoporosis are fracture around the wrist, fracture around hip, or spine fractures. The risk factors of osteoporosis can be classified into either modifiable factors or non-modifiable factors. Now, non-modifiable factors are those factors which are not under control, like female sex, they are more prone for osteoporosis. Genetic factors, if your family member is suffering from osteoporosis, then there is 30 to 40% possibility that you may also suffer from osteoporosis. Now, apart from that, there are some modifiable factors, that means which are within your control. Now, smoking and excessive alcohol intake, that leads to osteoporosis, and it has been found that if you take more than 3 units per day, that leads to osteoporosis. Second important factor is your level of calcium and vitamin D in your body. So nutrition is a very important factor. In patients who have low intake of proteins, calcium, minerals or vitamin D level, they are more prone for osteoporosis. Inactivity, lack of exercises, it also leads to osteoporosis. Some diseases also make the body more prone for osteoporosis, such as your thyroid problems, kidney problems, rheumatoid arthritis. If the patient is on some prolonged drug use like steroids or anti-epileptic drugs, they also lead to osteoporosis. Osteoporosis should be suspected in every female who is above 50 if she comes with any fracture around the wrist, hip, or complains of any back pain. The commonest method to diagnose is X-rays and DEXA scan. Now, X-rays can show that the density of bone has gone down, but osteoporosis can be diagnosed on X-ray only if the bone loss has been more than 30%. So that is quite late. The gold standard for treatment for diagnosis of osteoporosis is DEXA scan. So DEXA scan is a procedure by which we can diagnose osteoporosis quite early. Apart from that, we need to do some blood tests also to rule out any other problems such as thyroid problem or any carcinoma or any other generalized problem leading to osteoporosis. You should have proper balanced diet intake to prevent osteoporosis. So that includes adequate amount of protein, calcium, minerals and vitamins. Vitamin D is very essential to prevent osteoporosis, and we fortunately have abundant amount of sunshine in our country, which is the rich source of vitamin D. Now, apart from that, you need to do exercises on regular basis. A direct correlation has been found between bone strength and muscle strength. So, weight strengthening exercises, resistant exercises, which increases the muscle mass, they are important for osteoporosis, to prevent osteoporosis. It has been found that if you have good peak bone mass in adolescent, then there are very low chances that you will have osteoporosis in later part of your life. Once the osteoporosis has been diagnosed, then the treatment usually is divided whether the patient has come with a fracture or before fracture. Now, if the patient has not sustained fracture, then we give some drugs that includes calcium, vitamin D, bisphosphonates. Then there are some newer drugs like teriparatide injections, which helps in very severe cases. Along with that, we also advise some exercises which increases the bone mass. If the patient has come with fracture, then it has to be treated. Hip fractures or wrist fractures, they require some form of orthopedic intervention. For hip fractures, we usually do surgery, we replace the hip joint. For wrist fractures, we give some cast. The patient frequently comes with back pain, and because of osteoporosis, the backbone, it becomes deformed, or there is a hunchback deformity. So in those cases, we give some form of splints to prevent this deformity, and we also advise exercises for the spine. Now, osteoporosis, though not lethal in terms of mortality or causing death, but it significantly reduces the quality of life. Because of all these deformities, the patient continues to have pain, they have difficulty in walking. After hip fracture, the patient frequently requires some sort of aid to walk, so their mobility gets restricted. Because of deformity in the rib cage, the breathing also becomes difficult, their respiratory capacity decreases. So, though it doesn't causes death directly, but it significantly reduces the quality of life for the patients. Now, the management once fracture has happened is only to make the patient more mobile. The best thing is to prevent it. So prevention is better than cure. It holds very true for osteoporosis. One should have a good diet, a balanced diet, adequate intake of calcium and minerals, good vitamin D levels, and exercises to prevent osteoporosis. Once the osteoporotic fractures have developed, then one should consult their orthopedic consultant or their physician nearby.